Hello. Welcome. Have you ever experienced frequent stomach pain, bloating, or unpredictable bowel habits that just don't seem to go away? You might be dealing with something called Irritable Bowel Syndrome, or IBS, one of the most common digestive disorders worldwide. IBS is a functional gastrointestinal disorder, which means that there's no visible damage to your digestive organs, but the way your intestines work is disturbed. It affects the large intestine, also known as the colon, and can cause a variety of symptoms that often come and go over time. The exact cause of IBS isn't fully understood, but experts believe it results from a combination of factors, including gut-brain communication problems, abnormal intestinal contractions, bacterial imbalance, food sensitivities, and stress. The gut and brain are deeply connected through a system called the gut-brain axis, and when this connection is disrupted, it can trigger IBS symptoms. The main symptoms of IBS include abdominal pain or cramping, often relieved after a bowel movement, bloating, and gas. Changes in bowel habits such as diarrhea, constipation, or sometimes both, mucus in stool. IBS is classified into three main types. 1. IBS-D, where diarrhea is the main symptom. 2. IBS-C, where constipation dominates. 3. IBS-M, a mixed type with alternating constipation and diarrhea. Now, you might wonder, is IBS dangerous? IBS is not life-threatening, and it doesn't cause permanent damage to your intestines or increase your risk of colon cancer. However, it can severely impact your quality of life, making you feel uncomfortable, anxious, and socially withdrawn. When it comes to diagnosis, doctors usually rely on symptoms and rule out other digestive diseases through tests like stool analysis, colonoscopy, or blood tests. The Rome for criteria are often used to confirm IBS, focusing on recurrent abdominal pain associated with changes in bowel movements. Although there's no permanent cure, IBS can be managed effectively through lifestyle and dietary changes. Here are some helpful tips. Eat smaller, more frequent meals. Avoid trigger foods such as caffeine, fatty foods, and dairy if you're sensitive. Increase fiber intake if constipation is a problem, or limit it if you have diarrhea. Stay hydrated and exercise regularly. Manage stress through relaxation, yoga, or meditation. In some cases, doctors may recommend medications such as antispasmodics to relieve cramps, laxatives for constipation, or antidiarrheal drugs for frequent loose stools. Probiotics and low-dose antidepressants may also help balance the gut and calm the nervous system. Remember, IBS is a long-term condition, but with the right care, most people can control their symptoms and live a normal, healthy life. If you often experience digestive discomfort, don't ignore it. Consult your doctor and take steps to manage your gut health, because a healthy gut means a healthy you.